Hello, my name is Sarah Schwartz, and it's an absolute pleasure to join you here today. I am the pediatrician in the Ehlers-Danlos syndrome clinic at the Hospital for Sick Children in Toronto, Ontario, Canada. And I have the privilege, along with a team, some of who I'll mention here today, of caring for children and young people with HSD and EDS and related conditions. And I'm here to speak with you today about some ways we can support children and young people with HSD and EDS. Before we dive into the presentation, I just want to disclose I have no actual or potential conflict of interest in relation to this program. And I want to give a special thank you to Brianne Burton, the physiotherapist that I work closely with in the EDS clinic, for sharing some of the slides that come later in the presentation. HSD and EDS are complex conditions that can have a range of direct and indirect impacts on children and young people. You've heard from many excellent presenters over the past 2 days who have reviewed an incredible amount of information. My goal today is to share some practical approaches and tools that can help you support children and young people with EDS and HSD. Some of this may sound like things you've heard in other talks, which will only serve to highlight its importance. And if each of you can leave this talk with 2 or 3 things that you can directly apply to your life or the life of someone you care about, that would indicate that I've achieved my goal. Now, while I want to be clear that this talk is not about a specific diagnosis, and instead will focus on symptoms and individual experiences, with a holistic approach to the whole person, I do want to acknowledge that the journey to receive a diagnosis is a significant part of many individuals' struggle with their condition. Particularly in children and young people, there's a need for earlier and more accurate diagnosis. And work in this area is being done all around us, and the society is actually playing a very important role in leading this. That said, I'm intentionally leaving that discussion aside for the next 30 minutes so that I can provide you with what I hope will be some practical information to help you manage your condition and or the condition of a loved one. We will spend our time together first touching briefly on the mind-body connection and then moving through a range of topics that will provide practical approaches to improving health and well-being. We'll talk about sleep, mood and relaxation, pain, management of hypermobility, body awareness and balance, and cardiovascular fitness. And lastly, I'll very briefly touch upon partnering with healthcare providers. And I look forward to soon after this meeting with you live for the Q&A. So let's spend a moment acknowledging the mind-body connection, a concept that is likely to be familiar to many of you. Let's talk about exactly what this connection is, because there's a very clear scientific basis for it. The mind and body work together and affect each other. There's constant communication between our brains and our bodies. This happens because signals travel from the brain to the body and then back again from the body to the brain. And we have natural chemicals, including hormones, among other things, that circulate in our blood. Some are produced in the brain and affect the body, and some are made in the body and affect the brain. Every day, thoughts, feelings, and stresses play a part in making changes in our bodies. For example, when we feel embarrassed, we may blush. When we feel worried or frightened, that can cause butterflies in the stomach. We also know that when we have emotions, that can also affect how we feel. For example, feeling stressed makes any pain we have feel worse. And that is a familiar thing to many people with these conditions. So the physical impacts the psychological and the emotional, and vice versa. And acknowledging the psychological does not invalidate physical symptoms. The psychological impacts are real. And the physical symptoms are real, and both need to be addressed. And this is an important lesson for individuals, but also healthcare providers. So I want you to keep the mind-body connection in mind as we move through this presentation, as well as the interconnectivity between the symptoms that individuals with HSD and EDS may experience over time. So jumping right into it, I'm going to begin with sleep because sleep is important and most people don't get enough. Most young people between the ages of 5 and 12 get about 9-ish hours a night, but most need 10 or 11 hours even every night. Sleep is an individual thing, and some kids need more than others. But I can't stress enough that both the brain and the body need sleep. In terms of the brain, when you sleep, the brain is actually really busy sorting through and storing information and even solving problems. The body needs sleep. We know this, we feel this. And the average young person has a very busy day between school and playing with friends, hopefully, and other activities. The body needs a break, and sleep allows the body to rest for the next day. And in particular, in individuals with HSD and EDS, pain and sleep can have a tricky relationship because lack of sleep have negative effects on pain. It can increase your pain and decrease your ability to cope with that pain. Pain can also make it hard to sleep. So pain can make sleeping hard, and lack of sleep can increase your pain, which can cause a really bad cycle. But if you improve sleep or improve pain, this can begin to break the complex cycle. So I'd like to share some tips for a good night's sleep. Some of this may be familiar, some of it may be new. All of it is important, and you can choose what applies best to you. Setting a schedule is one of the most important things, as is sticking to that schedule. So going to bed at a set time each night and getting up at the same time each morning really, really helps. Disrupting the schedule can cause insomnia or an inability to sleep. Even though sleeping in on weekends or days off from school or work can feel great that day, it also makes it harder to wake up early when you go back to your regular schedule because it resets your sleep cycles for a later wake up. In addition to setting a schedule, exercise can really help with sleep as well. Trying to exercise for 20 to 30 minutes a day can help improve sleep. But a workout too close to bedtime can interfere with sleep. So for maximum benefit, try to get that exercise at least 5 to 6 hours before going to bed. So morning, early afternoon. We'll also talk about exercise in the context of other symptoms and experiences that patients with HSD and EDS may have, but you can already start to see some of the overlap. Another thing that can help with a good night's sleep is avoiding, of course, caffeine, nicotine, and alcohol. This is directed more at adolescents than our younger children, and there are, of course, other reasons to avoid caffeine, nicotine, and alcohol. But I also wanted to make note of the fact that they have a huge impact on sleep as well. And for the younger people, it's important to remember that foods can contain caffeine. So it's not just coffee, but things like chocolate and soft drinks and some other pain relievers. Relaxing before bedtime is actually a really intuitive thing that we think of with babies. So we think of baby's routine, bath, book, lullaby, but we do this less and less as we grow up, and we do it less and less for ourselves. But a warm bath, reading, or another relaxing routine can help make it easier to fall asleep. And you can train yourself to associate some restful activities with sleep and make them part of the bedtime ritual. If possible, sleeping until sunlight and waking up with the sun or very bright lights, depending on where you live in the world, can help with the body's internal biological clock, and it can help reset itself each day. Sleep experts recommend exposure to an hour of morning sunlight for people having problems falling asleep. And generally, although it can be tricky because the bed is really supposed to be for sleeping and not for other activities, if you can't get to sleep, it's probably best not to just lie in bed, because sometimes this can increase anxiety about falling asleep. So you can do something else like reading or listening to music until you feel tired. And then, of course, depending on the individual circumstance, considering white noise, weighted blankets, even melatonin in some cases can be really helpful. Mood and anxiety in particular are common concerns in HSD and HEDS population. And there are many reasons and causes, but they can impact other symptoms that you may be experiencing, as well as overall well-being. Thankfully, relaxation and mindfulness can help. These can take the place of more formal treatment when needed for diagnosed mood disorders and other conditions, but across the board, relaxation and mindfulness can be helpful to most people. I want to take a moment just to stress the importance, as we dive into this difficult topic, on self-compassion as well as compassion for others as everyone continues on their individual journeys. We all have experiences of unpleasant emotions, and this can be overwhelming. I wanted to point out that meditation can help when hit with a moment of suffering. That can be an unpleasant symptom in your body or experiencing unpleasant emotions like anger or sadness or anxiety. These physical or emotional experiences can be overwhelming, and sometimes meditation can help navigate this in a new way. And so I've just shared a link. Sick Kids, so the Hospital for Sick Children, the hospital where I work at, has a wonderful series on About Kids Help With It, which is where our patient and family handouts, and they have a series of audio meditations on YouTube, and one in particular on self-compassion, which I highlight only because I know that many have found this helpful. Again, this is not to replace proper diagnosis and management of mental health conditions, but rather a tool that can be used for anyone in the moment. Another extremely helpful tool is calm breathing. And I know that this is something that many of you have heard in the earlier sessions. I just want to briefly walk through it again because so many people find it helpful. Calm breathing is a technique that helps you slow down your breathing when feeling stressed or anxious. Why is it important? Sometimes when we're feeling stressed or anxious, we take short, quick, shallow breathing, and that's overbreathing. And overbreathing is responsible for changing our body and making us feel tingly and even more anxious and faint. So we got to stop that overbreathing. Calm breathing is a great portable tool that you can use whenever you feel this way, but it requires practice. And the purpose of calm breathing is not to avoid the anxiety at all costs, but it just helps take the edge off, or it helps you ride the feelings out instead of things escalating and getting worse. So how do you do it? Again, I'm just briefly going to walk through it because I think that this has been covered before. It's just regular, slow, smooth breaths. Sitting upright is usually better than lying down. And it's best to take the weight off by supporting your shoulders, by supporting your arms on the sides of an armchair or your lap, whatever feels most comfortable. And you take a slow breath in through the nose, breathing into your lower belly, about 4 seconds. You hold your breath for 1 or 2 seconds, and then you release and wait a few seconds before taking another breath. And usually just 6 to 8 breathing cycles can help decrease some of that immediate anxiety. It helps to practice this so that you feel really comfortable doing this when you're calm before you need it when you're feeling anxious. So practicing getting comfortable means that you have calm breathing in your toolkit for when you need it. Another helpful tool that I've seen many people use was a well-known grounding technique, which is a simple but effective way to regain control of your mind when anxiety threatens to overwhelm you. And this is the 5-4-3-2-1 technique. And I promise you, you can easily Google it and come up with lots of different references and resources referring to the 5-4-3-2-1 technique. You gain awareness through your surroundings by looking at 5 things that you can see, 4 things that you can feel, 3 things that you can hear, 2 things you can smell, and 1 thing that you can taste. And by working through this at the end, people arrive at a more calm place. Pain is a huge, huge topic for individuals struggling with HSD and EDS and related conditions. There's acute and chronic pain. There's multiple components to the pain. And often people develop on top of that a fear of pain. And many enter into a persistent pain cycle as outlined here on this slide. Many important contributors and many factors that contribute to this and feed into this pain cycle include anger, worry, sadness, frustration, depression, fear, anxiety, stress. And this is something that takes a lot of time to work through, but it's possible. And the approach to pain needs to involve all 3 Ps. So the 3P approach, I think, is one that we find most helpful. And you pick and choose from each of the 3 different Ps, but each one needs to be addressed. Physical approaches, these can include helping the child or young person choose a level of physical activity which will not cause harm, and balance this with periods of rest, with periods of activity. We'll talk a little bit more about that in a few slides from now. The psychological approach includes changing thinking patterns to reduce pain-related fears and stress, and using techniques such as distraction, guided imagery, and relaxation. Talked about some of these already. And then pharmacological approaches, which, like the other 2 Ps, need to be tailored to the individual, can include over-the-counter and prescription pain relievers when needed. Hypermobility. So this is the meat of some of what I wanted to talk about today, because hypermobility will impact different people in different ways at different times over their lives. Hypermobility means that your joints can move more than other people's can. It can occur at one joint or in several joints in the body. And a joint can be hypermobile for a variety of different reasons. It can occur because of loose or lax connective tissues, such as ligaments. And this is familiar to many of the people listening today. But it's also important to know that some people can be hypermobile because of bone shape, so they have shallow joints, or because of low muscle tone, because the muscles are loose around the joints and aren't doing a good job of supporting it. And joint hypermobility can occur in anyone, and not just in people with heritable connective tissue disorders or related conditions. And hypermobility doesn't always lead to problems. In fact, some successful athletes have joint hypermobility. But sometimes people with joint hypermobility experience symptoms such as pain and fatigue, and that's what we want to avoid. So, what are the core principles of managing joint hypermobility? And that's what I've outlined on this slide. Number 1, staying active is really important for your overall health. Daily exercise, if possible, will help keep you out of that pain cycle of decreased activity leading to increased pain. Strengthening and aerobic exercise keep the muscles around your joint strong. So there's the cardiovascular health, but there's also what's going on around individual joints. Stopping exercise altogether can lead to weaker muscles and lower endurance, which actually make your symptoms worse. And this is where a physiotherapist can be really helpful on working on strategies to help you participate in your activities with less pain and less fatigue. So some good examples of exercise for people with hypermobility: biking and swimming, because they have a lower impact on your joints than other activities. And these are fun ways to improve endurance, strength, and overall health. High speed and high impact activities like football or hockey put you at greater risk for injury because it's harder to control forces on your body. So these sports have a higher risk of injury for any person, not just individuals with hypermobility. So it's important to consider risks when choosing a sport. I wouldn't put it completely off the table if one of these sports is someone's life passion, and that's where working with physiotherapists may be helpful in determining how to engage in these types of activities. And then, of course, pacing is really important, especially with a new activity. And don't forget time for relaxation. And we'll talk all about all of this in a little bit more depth. So physiotherapists. Physiotherapists are movement specialists. They see how a person moves and they facilitate changes that can help them reach their goals. And they develop exercise programs to address symptoms associated with joint hypermobility, but also help with strategies to prevent worsening or new symptoms. So what to discuss with your physiotherapist? I try to encourage patients and their families to ask these three questions. Prevention. What am I doing to prevent symptoms and injuries? Improvement. What are my goals and what am I doing to reach them? Now, those goals should be individualized. They should be what that person wants to reach, but it's really important to start with small, realistic goals. So I would discourage against an immediate goal being, I'm going to walk in today and my goal is to run a marathon. Running a marathon is a wonderful goal to have in the very, very, very long term. But creating small, achievable goals is really the way to get to some of those long-term goals. Management. When I have a symptom or an injury, what will I do to manage them? So walking through each of these with a physiotherapist will be really helpful in addressing what one is experiencing at that time, but also moving forward. People with joint hypermobility are sometimes more clumsy than their peers. And I wonder if this resonates with some of you today. This can lead to frequent falls, and it can lead to injuries like ankle or wrist sprains. Another contributing factor is that the sense of joint position, which some people call proprioception, but we can just call it the sense of joint position, can be worse in joints that are hypermobile. Proprioception, or the sense of joint position, is your sense of joint position without looking. So if you close your eyes, knowing where your body is in space. And this can affect balance and coordination, and is a skill that you can actually work on. If you have hypermobility, you may need to work harder on balance and coordination than other people. And having a good posture and a strong core is a really good place to start. So putting all of this together, the best approach for children and adolescents with symptomatic joint hypermobility tends to be a reverse approach to typical physiotherapy, starting with a foundation of body awareness, building on that core training, and then getting to functional strengthening. So you may wonder, going to physiotherapy for the first time with a knee injury, expecting them to focus on your knee, why a really good physiotherapist, knowing that you have joint hypermobility, might first want to address posture, for example. because strengthening your core and addressing body awareness will give your body a strong base. Strengthening and learning to control your muscles will help support your joints in an optimal position. Because with poor posture, you put extra stress on your joints. And doing an exercise or activity, or even walking or sitting in class with poor posture, can add to pain and fatigue. And again, people with joint hypermobility may have to work harder than others on their posture. And we've talked a lot about joints and strengthening, but of course, all of this needs to be happening in parallel with working on cardiovascular fitness. There is a cycle of inactivity that unfortunately many people fall into. It starts with pain, and then you're told to rest because you have pain, but then you have weakness and muscle imbalance. And we've talked about the impact of that. You can have painful movement, and then you move even less, and then your fitness is less, and then you have more painful movements, and then you move on, and so on and so forth. So this cycle needs to be broken. And what is the best approach? It is not to jumpstart with a crazy, intense exercise program, no matter how motivated you are and how impressive that may be. It's to take things slow and steady and incrementally build your strength, build your cardiovascular fitness, achieve those small goals, and then meet your long-term goals. I know many people have experienced that crash that can come after a really intense day or a seemingly not so intense day with a new activity. And what I would hope is that most people could work to avoid those intense peaks that then lead to those big crashes. And this is where pacing and relaxation can come in, because some people try to be active or exercise with the very best of intentions, and it makes them feel worse. So pacing really can help with that. And what that means is doing things for shorter periods of time or at an easier level with plenty of breaks. This can be something that's hard to do, especially if you're doing it, for example, alongside your peers and you're not doing things in the same way that they are. That can be something that's really, really frustrating and hard because you want to keep up and you feel maybe in that moment that you can keep up, but the impact that it would potentially have can be remarkable. So what to do? Well, with any new activity, practicing a few times to find out how long you can do it before you dive in, it can be helpful. And when you try again, take breaks before you get to that point. And as you get stronger and fitter, you may find that you're able to increase the time or difficulty of your activity. But this takes time, so we have to be patient. It's not worth the risk. It's not worth the crash. Relaxation is important too. Muscles can get tight in response to pain and fatigue. Tight muscles may make symptoms worse. Deep breathing, like we've talked about, and gentle movement can help muscles relax. Some other quick tips. So no party tricks. I know people with joint hypermobility can move their bodies in lots of interesting ways, but it's important not to overstress the joints. Other things that may or may not apply to specific individuals: supportive footwear for activities, including orthotics if recommended, an occupational therapist to suggest strategies for issues in school, and then appropriate use of braces. So braces take the place of ligaments and muscles to support a joint. So sometimes it's necessary, for example, to prevent injury during a specific activity, but it's not always a good idea. Because it takes the place of the muscles will get weaker if you wear it all the time. And lastly, This is a little tricky for a global audience because there are differences in healthcare systems that impact the way individuals receive care in different parts of the world. So I just want to use this last slide to share some basic principles and remain open to any specific questions people may have in the Q&A. So primary care providers can be incredible supports, but they're most helpful when they're kept in the loop. And that leads into my next point, that communication between different providers is important. So it's most helpful when you ensure letters or reports or results are being sent back to primary care providers and other key members in your care, so everyone knows what's going on. Because again, as we've discussed today, many symptoms and conditions can be related. And lastly, care plans can be helpful. So a note with a summary of conditions, medications, care providers in a one-page document can be really helpful when seeking care to get healthcare providers up to speed on your condition. And with that, that is all for me for now, and I look forward to chatting more in the Q&A. Thank you for your time.